The medications you're taking for flu symptoms interact with foods and nutrients in ways most people never hear about from their doctor or pharmacist. Yet these interactions can affect both drug efficacy and your nutritional status. Let's start with acetaminophen, which many people take for fever and body aches. Repeated use depletes glutathione, your body's master antioxidant. This isn't a concern with occasional use, but during multi-day flu when you're taking it every 4 to 6 hours, you're creating significant glutathione depletion. You can support glutathione levels by consuming its precursors, cysteine from eggs and chicken, and vitamin C from fruits and vegetables. NSAIDs like ibuprofen or naproxen cause gastrointestinal irritation that's worsened on an empty stomach. Taking them with food or milk protects your stomach lining. However, food reduces peak drug levels slightly, so there's a trade-off between stomach protection and maximum pain relief. For most people, the stomach protection is worth it. Decongestants containing pseudoephedrine can interact with tyramine-containing foods, aged cheeses, cured meats, fermented products. This interaction can cause dangerous blood pressure spikes in susceptible individuals. If you're taking decongestants and notice headaches or blood pressure changes, consider tyramine in your diet. Cough medications need attention too. Dextromethorphan, a common cough suppressant, is affected by grapefruit juice through CYP450 enzyme interactions. Grapefruit can increase drug levels, potentially causing excessive drowsiness or other side effects. Liquid cough medications are often loaded with sugar. We discussed immune impairment from high sugar earlier, and this is a hidden source many people miss. If you've been prescribed antibiotics for secondary bacterial infection, interactions become more complex. Fluoroquinolone antibiotics bind to calcium, magnesium, and iron, dramatically reducing absorption of both the antibiotic and the minerals. Take these medications at least 2 hours apart from dairy products, antacids, and mineral supplements. Tetracyclines have similar binding issues. Probiotics become essential during and after antibiotic treatment to preserve gut flora, but timing matters. Take probiotics separated by 2 to 3 hours from antibiotics so the antibiotic doesn't kill the beneficial bacteria you're trying to introduce. Nutrient depletion from medications is underappreciated. Repeated NSAID use can deplete folate over time. Long-term antibiotics deplete vitamin K and B vitamins because gut bacteria produce these nutrients. Medication-induced appetite changes affect overall nutrition. Some drugs cause nausea-reducing intake, while others might increase appetite. Alcohol deserves special warning. Many people use hot toddies or alcohol-based traditional remedies when sick. Alcohol interferes with immune function, making it harder to fight the virus. It interacts dangerously with acetaminophen, increasing liver toxicity risk. It worsens dehydration when you're already losing fluids through fever. Alcohol and illness don't mix, despite cultural traditions suggesting otherwise. Your pharmacist is an underutilized resource for identifying interactions. When picking up flu medications, ask about food interactions, timing with meals, and any nutrients that might be depleted. Pharmacists are trained in this, but rarely asked, and they can provide specific guidance based on your exact medications. Practical strategies include keeping a medication schedule noting timing with food, setting phone reminders for antibiotics that need specific spacing from meals, taking acetaminophen with food to reduce nausea while ensuring antioxidant-rich diet, and if on multiple medications, creating a chart showing what to take when and with what. The bottom line is that medications and nutrition interact in both directions, foods affecting drug efficacy and drugs affecting nutritional status. Being aware of these interactions allows you to optimize both therapeutic effects and nutritional support during illness. Most of these interactions aren't dangerous if managed properly, but ignoring them can reduce treatment effectiveness or worsen nutritional depletion.